They used every single tool in their toolbox and they discovered nothing. And so now the patient experienced that. I was like, I don't know what you're talking about. I understand all your bells and whistles, but my stomach really still hurts. And that feels like a gaslighting experience. But the doctor's really like, I've used all the scientific tools I have. There's nothing left. So we have this big gap between the patient experience and the doctor's understanding of that experience.
What's up, ladies? Welcome to the health class She Deserves, the show where we ditch outdated women's health myths and talk real bodies, real cycles, and real stories. I'm your host, Autumn Payon, and today we are speaking with Dr. Efrat Limandra, PhD, known as Dr. E. She's a nationally recognized nurse practitioner, educator, and healthcare disruptor. She founded one of the largest NP-led practices in the U.S. and leads EG Prep, a nonprofit education company that trains nurse practitioners nationwide.
It's worldwide now. It's okay.
Awesome. Worldwide. Perfect. We'll keep it. Through her podcast, The Medical Disruptor, and frequent national media appearances, Dr. E challenges medical assumptions and equips patients to think more critically about their care without abandoning science or going to war with their doctors. Dr. E, welcome to class.
Thanks for having me. Accidental, incidental accident. I love it.
Yeah, exactly. So let's jump right into it for listeners who aren't clear, perhaps, on what medical gaslighting is, because it's thrown around a lot. I see it on the internet all the time. Can you just give us a baseline definition to start off?
Yeah, and it's really an important definition because the word gaslight, it's a bit of a misnomer. We use it, and I use it because, to your point, it is something that patients know, like, oh yeah, I know what that means. I've never heard it before, but I can intuit medical and gaslighting. But we have to take it apart a little bit because gaslighting, by its true definition, has malice, right? True gaslighting is I'm purposely, maliciously going to convince you that that you're not understanding reality, right? That's the true term of it. So, and that is not exactly what's happening in medical gaslighting. So we use the term a bit colloquially, a bit loosely, but it's an important distinction because what we'll come to discover in our conversation together is that there actually is no malice in the gaslighting. It's a systemic indoctrination.
I love that we started off with that because I do think that is a big misconception, or yeah, I guess misconception would be the right word for people online, where we do demonize doctors sometimes in that space when that's not at all, the intent.
Right.
So let's dive into that a little bit more.
Yeah. Let's talk
What
about
I
that.
Yeah, what is, from, your experience and your perspective, what is the root then under the medical gaslighting? If it's not malice, it's not malintent.
Well, let's first think about the kind of the absurdity of it being malicious because let's assume this is going to be like maybe 3% of people who are actually just mean. So let's just take those people out of the equation who are truly just a-holes. Okay, so
Yeah.
we're removing those from this conversation, right? Because somebody inevitably is gonna be like, you don't know this one experience I had. So let's remove the
Right.
people who are truly mean. And God will take care of them. But generally speaking, imagine, my son's in med school. There is no world where someone decides in their 20s or 30s to give up the next 10 years of their life to study something that they're very passionate about. And every child that goes into this med school is certainly passionate about helping people and understanding disease. They don't do that and give up a significant amount of their time, of their youth, and a significant amount of debt just to come out to gaslight patients, right? So when you start thinking about it, these are really these are little munchkins that are going, like my son's 21, they're going to school. They're not doing it to come out to gaslight. But something happens when they're in school. And when you're in med school, you are taught a lot of amazing things. When you are taught to find disease and you are taught protocols and you are taught to think a certain way and listen to the story a certain way, all in an effort to find a diagnosis. And you are taught literature, scientific literature that is double-blinded, gold standard. And you start hearing this terminology that really help, for 10 years, you are in this church of medicine where you learned that only the data and only the curriculum that is taught in school is the correct data. And anything else, not only is it incorrect, but is dangerous. right? Snake oil. We have all these terms for it. So it's truly an indoctrination because if I said that to you and replaced med school with church, you'd be like, oh my God, that's crazy. 10 years and the church is teaching you that their Bible is the only Bible and any other Bible, any other religion is dangerous. But that's exactly what happens. And so they come out not wanting to malign or be malicious, but they come out truly believing that this is the gospel, that this is the only way medicine can happen, and this is the only true science. And while it is a very valid science and it has amazing life-saving tools, it is not the only science. And that is a piece that's missing. And so let me translate that to the exam room experience. I'll give an example that I think many of our listeners will appreciate. My stomach hurts. I have abdominal issues. I have bloating. I have I don't feel good itis of the
Mhm.
stomach. Insert your own symptom here. And you'll go to the doctor and you'll do the endoscopy and the colonoscopy and the CAT scan and the MRI, and nothing will be wrong. Everything will be perfect. At that point, the doctor has to conclude by nature of their education that you're fine, there's nothing wrong with you, and that maybe you're just a little bit anxious or have some issues, right? And they're not doing it to be malicious. They're doing it because they used every single tool in their toolbox and they discovered nothing, which means there is nothing. And so now the patient experienced that. I was like, I don't know what you're talking about. I understand all your bells and whistles, but my stomach really still hurts. And that feels like a gaslighting experience. But the doctor's really like, I've used all the scientific tools I have. There's nothing left. So we have this big gap between the patient experience and the doctor's understanding of that experience.
That's an incredible explanation because I mean, as we established in the beginning, there's a lot of misconceptions around, the doctor side of things and the patient side of things and that disconnect. So you really explain that super well. And as a recovering Catholic, I love the church analogy because that is very much like what I grew up hearing was, this is the Bible, this is the church, this is what we teach, and everything else is wrong. Even other Christian religions wrong. Catholicism is the only right way. And so I can understand, obviously having not gone through med school, I can understand that analogy where if that's what is being taught, how else are you going to know? And you also mentioned the snake oil, like teaching that it's not just wrong. Everything else isn't just wrong, but it's dangerous.
Mhm.
Can you explain that a little bit more as because you obviously went and got then your functional nutrition?
I did functional certification. I did integrative PhD.
Okay.
Yeah,
Yeah, can you talk now having that perspective as
sure.
well? What is snake oil? What's not snake oil? How are you telling the difference?
It's a really, really hard question. Let's start with like the med school approach to it. There are studies, like the gold standard is double blinded studies, which means like you'll take a pill and you'll give one population the pill, one population a placebo. So no one knows, and they're blinded, so they don't know which one they're taking. So we kind of remove the placebo effect. And it's over time, over years. And that data tends to be the gold standard. There's a few problems with that. And then we'll come back to your question about snake oil. The problem is it requires a lot of money. So the only things that will be tested are things that at the end of the test can potentially create a profit to have paid back the investment of the research. So we will only research things that we can sell later on. Now, that's not necessarily a bad thing. I'm not like anti pharma. Cancer drugs and a lot of life saving procedures and equipment all happen because of these studies. So I'm very grateful to them, but it means that only those things will be studied. So, for example, if I say to you, hey, anecdotally, every one of my pediatric patients who have eczema, I take them off of dairy and their eczema goes away. Who's going to fund that study? There's no incentive to fund a study of like, let's try an elimination diet. There's nothing at the end of that rainbow that I can sell. So, getting funding for studies that are not inherently a treatment, a pill, a procedure that will eventually be covered by insurance is impossible. So we've established this gold standard of data, and it is certainly undeniably a high standard of data, but it can only apply to medication or surgical equipment. So we're really, really limited there. So, you know, in the medical school, if it's not studied, then it's not real. And there's no conversation of like, but how can anything else be studied? So then we have to go and say, well, that's true. Well, how can anything else be studied? So some studies are done at smaller levels, but the medical school won't, the medical community won't recognize them. And so we have this kind of dichotomy on the internet where like medical people are like, oh my God, you're crazy. If you believe anything other than our double blind studies, you're crazy. And that's a problem. So you have to do a lot of other research. There's a lot of research. And when I say research, I don't use that as some of our um, friends do, which they just mean they chat GPT or Google it. There are a lot of differently funded studies with smaller cohorts that come up with pretty amazing results. And if you find like, so many articles on a particular topic and they all come up with the same result, then, we're in the right space. So we have to kind of broaden our horizon of what we're considering studies. But then we also have to, at some point, recognize that there is a truth in a lived experience. So, and I think there are levels of how an individual should test things for themselves as well, right? So if someone I think there's like if someone's unwell, back to our GI example, I think they should first start with their PCP and their GI. Never skip that test. Never just ask ChatGPT, I'm bloated. What do you think it is? Right? Rule all the things out. Get all the testing done. Remember, the medical community is not bad. The medical tests are not bad. Use them to what they're for, and they are there for identifying pathology. So you're going to go do the test, make sure you don't have cancer, make sure you don't have an ulcer, make sure you don't have endometriosis that's showing up as a GI issue. Like, do all the things. And then, so now you've done all the safe things. You've kind of like checked off all the things the medical community wants you to do. Like, I did the thing, all the things you studied, I did. And then you can safely, for yourself, say, okay, I did that part, but now I'm still suffering. And now what is next? And then you have to start tracking your patterns, and you have to start strategically testing the same way that they test. I will try, I don't know, extra fiber for 7 days and see what that looks like. I will try a probiotic for 30 days and see what that looks like, and start believing your body. And I don't think that's reckless, because you did that first step. And there are other scientists out there. When I got certified in functional medicine, it was one of the most rigorous trainings I've ever received. The science was intense. The science was just as valid. It's just not part of the medical curriculum. With so much data and studies around what B12 can do and how selenium affects your thyroid. And there's a lot of data around that. It's just not going to be pharmaceutical double-blinded studies. So there is a spectrum of information. But if you're listening, you're like, well, you didn't really answer my question. How do I know what snake oil is? I would say there you have to start questioning or looking into who's selling the product. Who's selling the product? No disrespect to anyone, but one of the criteria I have to be a guest on my podcast is that you have to be clinically trained first. And then you kind of go off to the deep end and maybe spend some time in functional medicine integrated. But you have this baseline understanding of human anatomy and physiology, how things work. And then maybe you decide to become a hormone specialist, a functional medicine specialist. Those type of sellers, I would trust more than someone who is just an influencer who's like, wow, this is a great way to make this. Only works for me. I've tested it on myself. And now I'm going to. So I think who's selling it is important, because I don't, and I do think that, medical providers are great. It's okay if they sell. I choose not to sell things, but it's okay if they sell it because they've vetted it, but they're also willing to risk their license for it.
Mhm.
Right? If you're going to go and set up a
Yeah.
website and set up a shop and sell vitamin, and you just went to med school for 10 years and you
Yeah.
became a GYN and became a hormone specialist, you're not going to just sell something because people vilify them for selling. That they're allowed to make their money, but they're really risking their license and their reputation to sell that vitamin, right? So I think who sells it is really important, as opposed to like a 20-year-old guy who's like selling that and then selling a toaster the next day. Like, I think who's selling it is really, really important. And then I think as consumers, we have to get out of the mindset that there's going to be one thing that helps you. There is no one thing. I get to ask this
Mhm.
all the time. It actually irritates me. Like, I'll be out with people, and not my friends, random people, and they'll say, I just have one question, and I still don't feel well. And I'm like, first of all, I can't answer your question like that because I need like 2 hours with you.
Right.
But second of all, the fact that you are looking for this one supplement that's gonna make you feel better is already leading me to understand that you're not understanding it, right? So, it's very unlikely that you're gonna go purchase something for 19.99 and you're gonna feel great.
Mhm.
It comes down to the basics. I
Mhm.
know that was a long-winded answer, but I hope
No,
that was
though.
alright.
No, that was great. That was great. There's a lot of great information in there. And I think also in the endometriosis space that I am typically posting about, like on TikTok and stuff, a lot of people are like, oh, well, what do you use? And I'm like, what do I use? I have an entire pharmacy in my purse. Like, I have honed this like regime with, pharmaceuticals, supplements, KT tape, TENS machines. Like I have so many different things. It's not just like one thing that's going to help me feel better. And then it's the lifestyle overall. Am I sleeping enough?
Right.
Am I getting, reducing stress as much as I can? And eating well, eating lots of fiber, all of that stuff. And so a lot of people are really looking for that magic bullet. And it's like, I wish it existed. It just
Yeah, we
doesn't.
have to get out of that mindset. I find it
Yeah.
odd that the same people who are anti-pharma, who don't want to take a pill, are also like, "But I'll take this vitamin A, D, E, K, and I think it'll work." Like, God bless, take the vitamin A, D, E, K as part of your overall lifestyle plan, but there is
Hmm.
no one thing.
Hmm. Exactly. Yeah, and it's even I mean, there's the whole conversation of, like, what's actually in your supplement as well. That's a whole other thing because they're not regulated.
Right.
There's a lot in there that I definitely would love to circle back to. So first of all, when it came to you when you're speaking about medical research and, what's considered quality data, what is able to get published and, it being linked back to what can we sell at the end, I had like a tiniest little taste of research and academia in my undergraduate education. I worked in a lab, and I know that this being a women's health podcast, I know that when it comes to women's health research in particular, it's considered niche, even though, it's 50% of the population. And that in itself can also make research harder to publish. And I would love to know with your experience and your background, obviously, women and women of color, especially, are disproportionately impacted by medical gaslighting. Can you talk a little bit more about that, about what you've seen, about why that is from that research standpoint, perhaps, and, clinically?
I don't think this is the research standpoint, it's just a reflection of who we are as a society. In general, we don't listen to women. We
Mhm.
don't listen to moms. We stop listening to moms, right? We have names for them, helicopter moms. We definitely don't listen to our marginalized community. That's why they're marginalized. And we definitely don't listen to women who are from marginalized communities. So like
Right.
it is just a reflection. It's a mirroring of what happens everywhere else. And it's in our language. It's in our language. We expect our soldiers and our pilots who are primarily male to really trust their gut. But when it comes to women doing that, it's like woo woo. It's like intuition. It's like, but I know better. So, like, even in the language of how we apply to the very same skill in male dominated areas versus female dominated areas, there is a difference. So I think it's a mirroring. It's very and most of our doctors are still white and most of our doctors are still male. That is slowly changing, probably not fast enough. So it's just a reflection of, and then patients themselves have accepted the hierarchy and are coming in preloaded. We all are coming into the exam room exactly preloaded as we are in the rest of the world, and the dynamics don't change. In fact, they probably worsen.
Mhm. And, well, I love how you mentioned that at the end there because I know that your philosophy puts, like, a strong emphasis on patient responsibility as well. Can you
Yeah.
unpack that, talk more about what that means?
Of course, and when I say patient responsibility, I wanna be clear, I'm not blaming the patient, I don't blame the
Right.
victim, right?
Right.
What I want to do is empower. So, if we are in a bad relationship with someone, a partner, and we're like and every time we go hang out with this partner, we don't have the best time. And, you tried once or twice and you told him I'm just gonna say him for now, you told him, like, "I don't feel like you listen to me, and I tell you stories from work, and, like, I feel like you over talk over me," and, like, all these things, and you try it like 4 or 5 times, and then and you tell your friends what happened. Your friends will be like, "Sis, like, why are you in this relationship? Like, you have to go." right? You try a little bit of communication, and then that other person is like continues to do it, and your friends would all tell you over drinks on a Thursday night, like, "You have to leave this relationship." Right? They're not blaming you for the relationship, but they say you have to
Right.
go. You have to find a different partner. That's the same thing with your medical experience. Like people ask about that. How do I convince my doctor to XYZ? And the answer is you can't. If you go
Mhm.
into a medical exam room and you are not happy, it doesn't make sense to get loud. It doesn't make sense to like, but look at all the things that I did. If they're not the one for you, they're not the one for you. And so you move on to another one. So that's part one. If you're not in a good place, you need to find a different provider because a good provider doesn't necessarily agree with you all the time. I certainly don't agree with all my patients. I don't say, yeah, fine, let's do everything you ask for because sometimes what they ask for just doesn't make sense to me as a
Mhm.
clinician. But a good clinician will be able to talk to you and tell you why this particular thing works, doesn't work, what they're looking for, what they're ruling out, what would be next steps, what would make them worried. Like really just say like, I hear you. I understand your concerns. Here are the reasons why I don't think you currently have a brain tumor and like walk you through that as opposed to be like, no, that's ridiculous. Like I'm not doing the testing. And so there's different ways to approach it. Like a good clinician should do that. That being said, the other part that patients have to know is not just that kind of personal dynamic, is they need to know just how much they can expect from a primary care provider or Western medicine in general. I shouldn't say Western medicine, modern medicine in general. You cannot ask your plumber to do electric. He wasn't trained. So you cannot ask your PCP to be like, but why won't you do an MTHFR? Why won't you run a mold test on you? Because that's not what they were trained to do. And just to go in there and to insist that they do what you wanna do, it doesn't make sense. So you go and you treat them just like you do the plumber. You ask the plumber to come for plumbing, and then when you have electrical problem, you go to electric. So you go to primary care for primary care. You go for conventional medicine. You go for the things that insurance will cover, and you don't push or go crazy that they won't see your way. For that, you go to your functional medicine provider or your integrative person. And it doesn't have to be one or the other. Keep them all. Keep your GYN
Mhm.
and your hormone specialist. Keep your PCP and your functional guide. Keep everyone because you're going to need each one of them for different things. So, understanding the limitations of your clinician and understanding when it's time to find someone else really puts the power back in your hands.
And I think, I mean, that's one of the main messages of this podcast as well is like your doctor works for you. And if you are uncomfortable in the office, you're unhappy, whatever reason, you can go and find a new doctor. And I also love what you say about, keeping everyone. You can have all of these different people for different things. And I have also heard that for friendships and relationships, like people expect too much from one person in their life. It's like,
Right.
no, you need your inner circle to everyone kind of has a I don't want to say a job, but they provide different types of support for you. And it's the same with your care team. And that is like true holistic. Like I think when people say holistic, they immediately think, ooh, like a woo-woo thing. But true holism, I think, is including all of these different modalities that can help you
I would
in all
just
these different ways.
I agree with you. I would just fix or, tweak one sentence that you said. I don't think the doctor works for you.
Mm,
The
okay.
doctor has a set of skills that you have chosen to come in and engage for the moment that you're interacting with that doctor. And that's the only set of skills they have.
Right.
So if you choose to use those skills while you're there and whatever they can do, and if and then you engage or don't engage, but the doctor working for you, just the way that's set up is set up almost to like it's not gonna be conducive to a good relationship to come in when that
Mm,
mindset, right? You clearly think that this doctor has a set of skills, or like this lawyer, or this plumber, or this, and you decide to engage with them for the time that it takes. And then it either works for you or it doesn't work for you, and then you go and you find a different, vendor or a
mhm.
different third party. That's the way to see it. It's a little bit more neutral than the doctor works for you. You're not beholden to the doctor, but the doctor's not beholden to you either. Just let's get it a little bit more like a little bit more transactional in a way.
Yeah.
Um, and I think that is more empowering because the doctor works for me, and then when the doctor doesn't listen to me, it's going to create frustration.
Mm, yeah. No, that's a good reframe because I never really thought of it like that, but now like listening to you speak, I'm thinking like, yeah, it because I just hear that a lot online, especially with endometriosis because, we do tend to interact with a lot of doctors who are constantly just dismissing us. And so I think when people say, "Oh, that doctor works for you," I guess maybe now the way I'm thinking about it is it's a way to kind of flip it because it feels like such a power dynamic where like the doctor is on top. And so people are like, "Oh, I want to take the power back." And so like you work for me. But hearing you explain it that way is definitely much more productive in the grand scheme of things
Yeah,
and in the
I don't think
conversation.
shifting the power dynamic should make the the patient higher than doctor. I
Right.
think it should
Yeah.
be like, we're transacting for this moment of time, and then we go our separate ways or we don't go our separate ways. I think that's important because it would also be unfair to the providers to, be beholden because you have in your mind the patients who are struggling with endometriosis, but there are also patients who abuse the system. There are also patients
Right.
who really have extremely unreasonable dots that they've connected. And so we can't give all the power in one direction or the other. You engage, each person brings a request and their skills, and it either works or it doesn't.
Hmm.
And I think
And
that's a
I
fair playing ground.
Yeah, I would agree, and I like how you say the, like, transact like, neutrality to it of a transaction and yeah, if
Yeah.
it's a good fit, it's great, if not, you move
Yeah.
along your
Yeah, you
way.
move along. Exactly right.
Yeah, absolutely. So, the system kinda teaches us to gaslight ourselves as well, and I would love to talk
Yes.
about this a little bit. If you have any advice for women listening who maybe are trying to rebuild that trust in themselves while also respecting their doctor's expertise.
Yeah. I think this goes back it's best with that metaphor of the relationship, right? So your friends tell you you should leave and you're like, "No, maybe it's not so bad. Maybe I'm not explaining myself well. Like maybe let me tell you the story again." Maybe
Mhm.
it's not, and then you go home and you're like, he's really is a nice guy. And like, yeah, sometimes he talks over me, but like, is it really that bad? There's definitely people who are definitely other guys who that I've dated that are worse, worse than that, right? So you go home and you gaslight yourself. And I think a lot of, especially women, will go home and gaslight and like, well, he said I'm fine. The doctor said I'm fine. So maybe my stomach doesn't hurt that much. Maybe I am making a big deal of it. Maybe I am anxious. Things have been crazy at work lately. And so if you're going home and second guessing your own body, that is not good. We don't want that outcome. And if you're like, well, I'm not sure how do I not second guess myself? I mean, he's the authority. So I would say this to you. Then here's another reframe. If this was your kid or your dog or your cat, you would know exactly what to do. If your kid is not right and you go to the pediatrician is like, no, I did all tests, they're fine. I don't think you'd go home and watch your kid still not be the same and say, "You know what? Maybe my kid's exaggerating." Maybe you would be like, "I think the doctor's missing something." And you'd either go back or you'd keep going. Same thing because you know your kid and you know your dog and you know your cat. So you have the skill set already. You know what it looks like to not second guess yourself, to go back and question the authority. We just don't do it for ourselves. So, whether that's removing yourself kind of like mentally and managing yourself as you would someone you love, or asking someone else to come with you into the exam room to help you and be like, no, remember, Susie, it's not just when you're anxious. Remember, we were on vacation having the best time and then you stayed in the hotel room. Like, you need if you can't do it for yourself, then bring someone with you to help you
Mhm.
through that piece.
That's great advice. I love bringing my mom with me to, like, important doctor appointments because she always also having somebody a third party is a bit more clear-minded. It's not there's the stakes aren't as high for them as it might
Yeah.
feel for the patient in the moment, and so, when I have my mom with me at, like, specialist appointments or whatever, she asks questions that I know I would have gotten in the car and been like, "I should have asked that."
Yeah,
And
100%.
she has
It's a
yeah, she
lot.
has them right
It's
there.
a lot.
Yeah.
It's a lot of questions flying at you. It's a lot.
Mhm. And like, mentally removing yourself is, like that like, a good therapy technique.
Mhm.
Something, I think a lot of people probably have learned in therapy, I know I did, of would you be saying this to your friend? How would your best friend speak to you? How would your mom speak to you? How would your sister speak to you? That kinda thing. So the same idea of, if this was a child or someone or something that I loved, how would I advocate for myself? I think that's wonderful advice. Are you seeing meaningful changes in how medical professionals are being trained when it comes to the gaslighting issue, or the indoctrination, as you said it in the beginning of the episode? Or do you still think that, there's
It's pretty
it's
bad.
not being addressed? Okay. Yeah.
It's not being addressed. I think that it's a hard one. I think that once a clinician really sees the limitations of medicine, they end up leaving medicine, like myself. Not fully, they might still have like I still have my practice, but you kinda end up doing something else on top of your practice. Like you end up becoming the hormone specialist or because it's very hard to practice within the system with this knowledge. Um, so the curriculum has not changed. The mindset has not changed. I have many colleagues who think everything I say and do is absolutely insane. I think that divide is going to get worse because now if you say certain buzzwords, you're because we've getting so divisive politically,
Mhm, mhm,
it's spilling over into science. So, like, for example, I am not an anti-vaxxer by any stretch of the imagination. However, I would very much like to talk about some of the adverse effects of vaccines and things that we can do. Like, I want to be able to have certain conversations around vaccines that can sound like I'm an anti-vaxxer. And in this world right now, you have to choose. Are you pro or against? And the reality is more in the middle. But because these buzzwords are a little dangerous sounding for those, kind of in medical hierarchy, there's even less room now for questioning or for saying things that might sound like the other side,
mm.
right? So I actually think it's getting worse.
That's a very great point to bring up because unfortunately, our political situation right now is a big part of the conversation medically. And it shouldn't be this
Yeah.
dramatic. It shouldn't be this polarized, but it is.
So we've associated anything that's I'm gonna say the word alternative, though I don't really vibe with it, but just for the sake of
Mhm,
like categorizing. Anything that's slightly alternative is going to be connected with a certain political agenda that may
mhm,
have nothing to do with the person saying it, and so the silencing has gotten worse.
mhm, mhm. I completely believe that, and it is such a testy time
Yeah.
from that sort of like wellness to alt-right pipeline that began on like with the internet. So many influencers kind of went that way. And then obviously we've got Maha, which, healthy, what does that really mean? It doesn't seem like, it's doing much in that regard. And so it is a very difficult time that
I
we're
see, I
living through
disagree.
right
I think there's
now.
a lot of things that Maha is doing that is really on point, but
Mhm.
saying that makes me, like, walk away from the other side, and I think there's things that Maha's getting on point. I think there's things in medicine that's getting on point, and I think it would behoove us to have a conversation in the middle.
Yeah.
And exactly kind of like that reaction that you had, that we had like the eye rolling when you said Maha is exactly the problem because there's a lot of solid gold things that they are saying there. There's a lot of nonsense, but it's
Mhm.
true on both sides.
Mhm. Well, yeah, that's a good point.
There really is. It's true. It's absolutely nonsense when I hear a GI person telling my somebody with Crohn's that it doesn't matter what they eat. Somebody with psoriasis that doesn't matter what they eat. Somebody right. So like there's some nonsense
Wow.
on both sides.
Yeah.
So being in the middle actually takes the most work. It's very easy to silo yourself and connect your science to politics. But being in the middle means my politics might be one thing, but my science I actually want to take from all sources. And I don't think we're doing that enough.
Yeah. I believe that. I can see that. There is a good amount of scientific illiteracy, I guess, in the population. As well that I think contributes to the issue. So, yeah, thank you for that and thank you for that middle ground because there is not enough of it for
Not enough.
sure.
That's
And
what I mean.
I mean,
Yeah,
yeah,
you don't have to be in the middle with your politics, but you should be in the middle with your science.
with the science. Yeah,
Yeah.
fair enough. Um, all right. Well, we have some questions from TikTok
Let's
that I
do
asked
it.
for
I love
people. We
that.
move into
I'm really
those.
looking forward to that.
Awesome. So, first one, how do you navigate a conversation with a doctor who keeps blaming your weight instead of investigating further?
Leave the doctor. It's really that
Good
simple.
answer.
You mean I'll break it down more, but this is what we said earlier. Like, you keep wanting this man to change.
Mhm.
He's not gonna change. He's not gonna change. Now, if you're, like, telling me, um, I live in rural somewhere and this is the only doctor I can get, then the right question would be, to ask. Say, "I hear you about the weight." If you really wanna engage with this person, I don't think you should engage with this person, but if you need to, say, "I hear you, and I know that your theory is about the weight, and I'm willing to listen to that, and I'm putting that on the side for right now. Would you be open to exploring what other possibilities could be causing this?" And just, like, being like, "I hear you, I acknowledge you, I heard you, dude, but can we," like, in a really nice way. And if he's
Mhm.
like, "No, I refuse, it's all your weight," you really have to get to a new place. Now, that being said, I do think people underappreciate how, not necessarily weight, but how a poor nutrition is gonna make you feel. And so we sometimes equate weight with poor nutrition. Now, it may not be the case. I don't know this patient, but I think a lot of people who are even mildly overweight are not eating really well. And if they're not eating well, they are not going to feel well. But their labs will be normal, right? They're not diabetic, they don't have cholesterol. They're just eating enough to not feel 100%. And so I just want to say that there is some validity to the idea, not so much that your weight is causing everything, but the way you're eating is causing everything, right? Because it's going to take a certain amount of eating to get very heavy, a certain type of eating to get very heavy. It means you're not intermittent fasting. It means you're not taking a break before bedtime, or it means you're eating really calorie dense food all the time. So, like, there is some validity in that your nutrition is off. You're going to feel off. But
Mhm.
if your doctor's really not willing to explore anything with you, you're just in the wrong room.
Yeah, and it comes back to, really everything we were talking about before of just self-advocacy, and if it's not fitting, it's not fitting, and you move on.
Yeah,
Yeah.
exactly.
Okay, next question. With each area of medicine being so specialized, how do you find care that values the body as a whole system?
You won't find it in conventional medicine. You just won't find it in conventional medicine.
Yeah.
It's just not possible. Um, it is great that we have highly specialized people. It is great that not only these days do we have a cardiologist, but we have somebody who's just in charge of the rhythm, and then somebody who's just great with valves,
Mhm.
and somebody who's just great. So it's amazing because if you're one of those people who have a very particular defect in your heart, it is great that you can go to someone who the past 40 years has only been looking at valves. Like, there is something wonderful about seeing the person who specializes in the particular part of your heart or your organ, and that's all they've done for the last 40 years. So there's something wonderful about that when you're sick. And conventional medicine is always going to hyper specialize because things are so each organ is so complicated and each particular procedure can get so complicated. So you are not going to get holistic care in conventional medicine. It's not designed that way, right? We don't at best you'll have the PCP who hopefully can put the pieces together. But with a PCP, as soon as things get complicated, they kind of have to refer you to the specialist. It's just how the system's set up. So you use the system for what it is, right? Plumber, electric. And if you want holistic care, you go to someone who's been trained in holistic care. It's not going to be conventional.
Mhm. Yeah, and I know that we touched on that a little bit before as well, but it's like conventional medicine's great for what it is, for recognizing the pathology, for getting disease, but when it comes to more
It's going to
preventative or
save
just
your
just
life if it
feeling more.
needs to,
Exactly.
you know,
Yeah. Yeah, and that's very important.
very
We need
important.
that.
Very important.
Yeah. Okay, last question from TikTok. Why do so many providers jump to anxiety to explain away pain or GI
Yeah.
issues like we were talking about?
Well, this goes back to the education, right? So if the education says, okay, someone has stomach pain, I'm going, you know, let's say pelvic pain. We did stomach already. Pelvic
Uh,
pain. I'm going to do all the tests. I'm going to do the pap smear. I'm going to do a pelvic exam. And I'll do an ultrasound, and maybe I'll do an MRI, and we'll do everything. And so we are trained in medical school that these are the things we have to do for pelvic pain. Here are the possible reasons. Here's a list of diagnoses. We call them differential diagnosis. And here are all the steps that we need to follow to make sure that it's not one of these diagnoses. And so this GYN will be very thorough and she will go through every single line to make sure there's nothing there. So if she went to her book of books and explored every line and found nothing, what is she left to conclude? She has to conclude that it's you. It's the design of the curriculum. If this is the ultimate gold standard medicine and gold standard cannot find what's wrong with you, the problem has to be you. It's the default conclusion. And so you means you're anxious. You're feeling it too much, you're thinking about it too much, you're sensitive. So if the patient experience is very much gaslighting, but when you follow the logic of the protocols and the guidelines, there is no other conclusion to reach.
Mhm. Yeah, and I think that this conversation that we've had today has been very insightful from that other side of things of how you are trained and how the system is set up, like you said, to go through all of this gold standard practices and well tested methods of finding the pathology. And when it's not found, it's just got to be anxiety or depression sometimes I've heard as well,
All the
kind of
same
thrown
thing.
at patients.
Yeah.
Right, yeah, just psychosomatic, I guess. And obviously there is we know that there is a connection between anxiety and gut issues, but it can go the other way as well, right?
Mhm.
Having actual real problems causing mental health issues. So
Of course.
thank you so much for being here today. This has been a really phenomenal conversation. I have one last question that I like to ask all of my guests.
Let's hear it.
So, if you could rewrite the health class curriculum that every woman deserves, what would your first lesson be?
The first lesson to the clinicians.
No, like just like health class. No, you could take it in any direction you want. I've gotten a lot of great answers for this, but like you could think of like a high school health class. You could think of like more of an adult health class.
Okay, so
Whatever
it's
comes
but
to
it's
you.
not for clinicians, that's important. Okay,
Yes,
so
no, not for
if it's
clinicians.
not for clinicians, it's for women, then I would say that this is not really a health class. This is, uh, just because this will be applied to everywhere in your life. And I would say to women, lean into your feminine energy. We have come to as a society to think that feminine energy is weaker. The feminine, you know, it is the strongest force. It is the strongest energy. I mean, women are naturally collaborators. Their intuition is close to divine. Um, the strength in their empathy is, I just in every aspect. I'm thinking back to like this past weekend with the family, how women play games differently than men. Somewhere in the world, we decided that all the adjectives that describe women are the weaker adjectives. And I would say it is time to double down that these adjectives are not just equal, but superior to the adjectives we give to the masculine energy. And once we really understand that your intuition counts and your voice counts and collaboration is not weak, dominating over others is not always strength. Keeps you alone and angry. When we start really understanding this is power, we will never be gaslit again.
I love that. That's an incredible answer, and I wholeheartedly agree because I see that so much just in our language, and it's something I've tried to reprogram in my brain of just automatically assume, like you said, like adjectives that are more feminine we deem as weaker or less than. And that's something that I try to reprogram in myself because I've noticed a lot of that indoctrination. So I love that answer. That's incredible.
Thank you. I try
Yeah,
to live by
thank
it every day.
yeah, it's amazing, and I think that a lot of women will need to hear it, so, thank you so much. This was really an awesome conversation. I think there's so much wonderful information in here that my listeners are gonna get a lot out of. They're gonna come out of this episode feeling empowered, and more educated, and, yeah, where can people find you? I know
Thank
you're
you.
very active online and
Yes. So my podcast is called Medical Disruptor, the Medical Disruptor, and my website, medicaldisruptor.com. I don't sell you anything. Maybe one day I'll sell you my book that I'm writing. That's it. There's no
awesome.
supplements. There's a free toolbar on my website where you can like search the episode for the topic, like you want to talk about fibromyalgia or whatever, you'll find it. We really just want to be a resource There's an opportunity to join the newsletter called the Medical Middle Ground, where we
Awesome.
explore each topic. So yeah, just come on by and just enjoy the content. We're here for the mission.
Amazing. And I will make sure that is linked for everybody below. Thank you guys so much for listening. Make sure you rate and review to help me out. Share this episode with a friend. And thank you, Dr. E, for being here and for teaching us today.
Thanks for having me.
Of course, class dismissed.